takes dreamers to dream dreams and put them into operation.
Since 1974, the Prevention Committee of the Saskatchewan Association for the Mentally Retarded had been pursuing their dream of an organization that would work to reduce the incidence of disabilities in children. A number of very committed individuals worked diligently to make the Saskatchewan Institute of Prevention of Handicaps a reality.
The context for the concept of the Institute came from a 5-year plan that SAMR board was putting together. It was one of the new initiatives that we recommended happen, and it was because we realized we're spending 100% of our budget on services for people already disabled and nothing at all on prevention of disabilities.
Al Anderson was the chairperson of the Saskatoon local branch of the Saskatchewan Association for the Mentally Retarded and a member of the Prevention Committee in the late 1970s.
And I said, maybe it's time for us to believe that things could be better for kids that wouldn't have to be born with developmental disabilities if we could do something about preventing them. Well, the audience was just absolutely receptive to the cause at that time.
The Prevention Committee worked to establish the mandate and parameters of organization and to seek funding.
The Kinsman Foundation decided to commit $500,000 to the Institute on the basis that the province of Saskatchewan would become involved.
And at about the same time, the Association for the Mentally Retarded committed $175,000. And I think those two levered government. They saw that if these sectors were willing to commit resources to this important concept, that they should probably be aboard as well.
The university came on board at that point through the office of Dr. Christensen, certainly, so that there was a commitment from the university to support the project as well. And at that point, then the government established through their interdepartmental committee, they established a framework then to proceed with the development of the project.
The financial support and guidance provided by the members of the corporation has enabled the Prevention Institute to continue to grow for 25 years. Project funding has been received from a number of agencies over the years, most notably the Public Health Agency of Canada, but also charitable foundations, service clubs, and government departments, among others. The Prevention Institute has always tracked its progress and worked to demonstrate its effectiveness. Even in the early years, the board members knew that,
Although it was a 5-year pilot project, it was pretty clear that once we were underway, this was no longer a 5-year project. We had to be concerned about sustainability and keeping the Institute moving forward. We had a pretty clear mission, certainly by year 4, that we had better be becoming effective to our shareholders, because we were coming back to talk to them again about sustainability of the Institute from a financial perspective, as well as a collegial perspective in terms of the areas of interest.
the Prevention Institute was initially housed in the Hentelman building on campus.
Forward, ultimately, as we know today, the Institute ended up going into the Kinsman's Children's Center, which was somewhat interesting because it, in fact, again solidified sort of a community support for the Institute, in that the Kinsman again had financed or funded a significant part of the move. Again, that was another evidence of sort of the cooperation and the mosaic of where this Institute fit from the healthcare professionals and from certainly from the president and the university.
The Prevention Institute is guided by a board of directors made up of members appointed by the members of the corporation. An executive committee, medical advisory committee, and communications committee are also essential components in the operation of the Institute. The Prevention Institute began programming in the areas of improved prenatal health, substance use during pregnancy, and by collecting information about genetic and other disabling conditions.
The number of brochures and information packages that we produced and got out to the community, to all the health regions, to the schools, became quite prominent. And then we were starting to get requests for them. We sponsored several national conferences, the first one on folic acid in Canada, I believe. and got people from across Canada talking prevention.
The Prevention Committee of the Saskatchewan Association for the Mentally Retarded, which became the Saskatchewan Association for Community Living, outlined objectives for the organization: public and professional education, translation of existing knowledge, and the provision of a visible single focus, a publicly identifiable confluence for concerns about prevention of disabilities in this province were significant among the objectives. Following a tour of prevention centers in the United States, Al Anderson recalls a significant gap.
What I do remember very specifically was that when we would ask the question, what have you done with all the research you've gathered? Then there was that lull. It seemed to just sit in journals and publications. That's exactly what we felt couldn't happen and shouldn't happen.
One of the earliest messages from the Prevention Institute was the importance of avoiding alcohol, tobacco, and other drugs during pregnancy.
And I look today like fetal alcohol syndrome as an example, just one of those things. When we first introduced it, it was again almost a joke when people would say, what do you mean fetal alcohol syndrome? Today, almost all of society knows that when somebody says, hey, Mom, I'm pregnant, mums today are saying, well, one thing you know for sure, dear, you can't drink.
Or smoke.
Or smoke if you're going to have a baby. I mean, just that one alone.
Because you're smoking and drinking for two.
Isn't that true?
Yep.
You know, that one thing alone today has made everything worthwhile, if nothing else. And look at all the other things. It has been one of the Kinsman, the $500,000 and the $175 that provincial board put in has been multiplied by a number that's impossible to calculate.
The Prevention Institute has educated about alcohol use during pregnancy for many years. Awareness is high, and the challenge is to get the messages out in effective ways to all, and to find new strategies to reach those who are addicted and need additional help to make healthy choices. Tobacco, the source of another addiction and its harmful effects on pregnancy, has long been addressed by the Institute. Projects, presentations, and public service announcements help to spread the messages. The Prevention Institute has worked in the area of perinatal infant health since its inception. In 1977, the Prevention Committee identified as one objective to actively promote current information about prenatal, natal, and postnatal care for mother and child. Good prenatal care, neural tube defects and folic acid, newborn screening, child death review, and sudden infant death syndrome are areas of programming. The Prevention Institute focuses on two major programs in parenting: Nobody's Perfect and the Healthy Parenting Program. Nobody's Perfect program has trained over 1,000 facilitators in Saskatchewan, and the Healthy Parenting Program, which is available either in book form or online, has been accessed by over 4,000 parents. The Prevention Institute hosted the Prevention of Adolescent Pregnancy Symposium in 1983. Since 1991, the Institute has been the home of the Advisory Committee on Family Planning. Conferences, ad campaigns, reports, and the establishment of teen wellness centers have been used to work toward the mandate of reduced teen pregnancy through comprehensive sexual health education.
As a child grows up,
the Prevention Institute has a major role in child injury prevention in Saskatchewan. It has assisted communities in their injury prevention campaigns, provided training for child passenger safety, and increased awareness about bicycle safety through its leadership of the Saskatchewan Coalition on Bicycle Safety. The child and youth injury reports prepared by the Institute have helped communities determine priorities for prevention. A Community Development Coordinator for the Community Action Program for Children, CAPC, a program of the Public Health Agency of Canada, has been an employee of the Prevention Institute since 1994. CAPC provides community-based programming, and the role of the coordinator is to act as a link between the Public Health Agency of Canada and the community-based organizations, to assist those working at the community level with administrative matters and to provide education to enhance programming. The Prevention Institute has shared its expertise beyond the borders of Saskatchewan. National conferences have been hosted by the Institute. The FAS Resource for Professionals has been reprinted in the United Kingdom. Kukum's Gift, The Gift of Fire, was distributed through the northern United States and Alaska. The Rue poster was used throughout northern and western Canada. The environmental tobacco smoke commercials featuring Thomas were used in New York State, and the Healthy Parenting online version is accessed worldwide. The Institute has also taken the lead on national projects, such as the development of a Train the Trainer program for child passenger safety, and a joint statement and multidisciplinary guidelines for shaken baby syndrome.
How do we know this is working? How do we know this is money well spent and effort well committed? So what would your answer be today? How do you know?
Well, you know, today it's phenomenal what has happened with the Institute. It has become a recognized institute internationally. They look to the Institute now for direction in all of these areas. And the thing that has impressed me most is it has never moved away from the initial goal.
Because it was always primary prevention, that is through public education, and that came to be and still is the very core of the program.
And I think the interesting thing of the Institute, as well as the community programs, is that over the 25 years the Institute has been in existence, it has never been a static entity. It has evolved and growing, and you've built a foundation today that will say the Institute over the next 25 years or the next 50 years will grow and evolve again. But your foundation is very solid.
The Prevention Institute is especially grateful to its founders and to those who have remained committed to the concepts of primary prevention and the reduction of the occurrence of disabilities in children.
Those that were involved were not anything special in life. It was just that many of the people that were involved were people that had young families with disabilities.
It's been my great privilege to be involved with the Institute. I always hearken back to the early founders and our funders and the sincerity with which they brought to the issue of preventing handicapping conditions in our province. And the issue that we deal with on a day-by-day basis is, have we done everything that we can to provide credible, sound, and easily communicated information to audiences? These are very much built on that original founding spirit. If we as a province continue to move forward with that sincerity and selfless attitude, I know the future is very bright for the Institute. The continuing success of the Institute will depend on our ability to engage direct actors in the community, be they in leadership positions or simply a caring parent or caring person who helps people in situations where they're looking to bring healthy lives to young people. All we have to do is remember the selfless acts that established this institute and look forward in that giving way.
We're passionate and committed to carrying out our prevention and health promotion programs. We know we make a difference, and we look forward to the future.